All right, Jay Oliver back with you. We're talking with Dr. Brett Ruffo. He is a board-certified colorectal surgeon over at the Peconic Bay Medical Center. Great to have you here, Doctor.
Thank you.
Talking a lot about the month of March, really Colorectal Awareness Month. Riverhead going blue.
It's phenomenal. This Go Blue campaign was exciting. I mean, I think we're the only people on Long Island doing something like this.
I think you are.
And the businesses in Riverhead have really just done some outstanding things already. I mean, we have some of the shops even naming drinks called Bottoms Up, just all these sort of things just to get people aware. And what's important is you have the businesses aware of this as well. So it starts generating a significant exposure, and people are really responding. And I think it's starting to get the message out there how important this screening is. I mean, we even had the American Cancer Society out there as well. So we have a lot of seems a lot of fire in everyone to get this going.
You know, when you talk about colon cancer, it just seems like is it as bad as pancreatic cancer? Is it lung cancer? We know what lung cancer is, the second biggest as far as the cause of death. But is there an age group that is more susceptible? Is it both? Have you seen both young and old? Well, some people just say, "Oh man, listen, I'm 20 years old. Why do I need to get a checkup for in that regard?" What have your findings been?
There's a lot of questions in that question. Number one is it as bad as pancreatic cancer? My answer to that is any disease that can kill you is not too good, especially if we have the ability to make it better.
But it seems like it's more aggressive.
Pancreatic cancer is a whole different cancer, and we don't have a lot of prevention for that. What people don't understand, though, which I always find fascinating, is that it gets the amount of recognition it gets in comparison to colorectal cancer, when colorectal cancer kills an enormous amount more people. So is it as bad? Sure it is. Once it's there, you talk about poor quality of life and pain and just misery of living. And so, yes, it's any cancer like that. It can be aggressive and just miserable from a quality perspective. We don't typically screen 20-year-olds. However, there is a small subset of patients that we would. But now we're getting into not the average patient. There are always exceptions to everything. We look at the fifth or sixth decade as the most common decade to be developing colorectal cancer. And that's probably, in essence, why the 50-year-old mark is still the mark. That's the standard screening mark for our country right now. Will that change? I don't know, maybe. Some of us have different thoughts on what we think the screening age should be. But anybody getting their screening starting at 50 is really pretty much on the ball of the data.
What about diet? We've heard so much about maybe high-fiber diets. What you eat can contribute to this type of stuff. How true is that?
Well, we know for a fact that high fatty foods, obesity, high meat contents, we know that the red meat, we know that these things certainly contribute to colorectal cancer. No doubt about it. We know that a high-fiber diet is probably the healthiest for the colon regardless. Do we know if it prevents polyps or prevents cancer? I'm not 100% sure on that. However, it is the best diet for the colon at this time. But high fatty foods, red meat, smoking, obesity, all of these things, and of course family history, but that's a different part of the conversation.
What about colonics? Is that something that's recommended, kind of a clean out, or you don't want to touch that?
I'm not a big believer in that, but that doesn't make it inappropriate. It's just that from my perspective is I want to clean the whole colon, not just from the anus. I want from the right side to the left. And it seems that a high-fiber diet regulating your bowel movements, that's probably the best way to keep you healthy.
No question about it. We're talking with Dr. Brett Ruffo. He is a board-certified colorectal surgeon. Next month, folks, in March, it's Colorectal Awareness Month, the month that will turn blue in Riverhead, pretty much the only town that is going to be going through this.
So far.
Very interesting. So, we've talked about a lot of different things. Give us maybe symptoms of colon cancer. What are some of the symptoms that one would have to look out if, for some reason, they have come down with this?
It all depends on where the tumor is located, but the most common things that we look for are really change in bowel movements. And I don't mean a change in bowel movement that happened today. I mean whatever your normal bowel movement is for 10 years is your normal bowel movement. But if you went to the bathroom once a day and now you're going 10 times a day, or you went 10 and now you're going 1, or you're having bloody stools and abdominal pain, change of appetite, unexplained weight loss, urgency to go to the bathroom unexplained, difficulties pushing and straining, new onset constipation, all these sort of things are concerning findings.
The color of the bowel movement, how key is that?
It's not necessarily key. I mean, because we don't know what's in them. I mean, because a lot of things can change the color of your stool. You could eat beets, so you could eat something you drink. You could have, again. So if you see blood or you think you see blood, the thing I always tell patients is if there's any concern of anything, just bring it to us and let us take a peek so we know, and we can help you figure that out.
Interesting. What about how often should one be screened? I know I was told, you know what, you're fine, come back in 10 years. Had a small little polyp, got rid of it, nothing wrong, sent it out, everything was fine. I'll see him in 10 years. How often, though, would you recommend?
Again, that's too for me. The screening from the standard of care, so to speak, for a normal person without any family history or no significant problems on their colonoscopy, 10 years is the recommendation. Most of us probably screen a little more frequently. I probably would recommend 5 to 7 years after. Why? Only because we know there's a missed polyp rate. Because we're not perfect, as is any there aren't any perfect screening tools. So if there's a missed polyp rate, I think 5 to 7 years is probably the best overall screening. That's my opinion, though. As for the standard of care, 10 years isn't inappropriate.
Interesting. And family history, we know about genetics, like in anything that is about, it's going to play a major role, I'm sure, in colon cancer, and
Huge.
It's no different.
To me, that's the number one risk factor is family history, besides a few other rare exceptions. The most important thing we can do as physicians is take a detailed history. I want to know who in your family had colon cancer. What were their age of diagnosis? Did they have polyps? Any other cousins? And these are things when we start developing a profile. And if we start seeing that there's multiple generations of colon cancer, multiple instances of colon cancer, then we'll certainly change our screening parameters based on that. That's for sure.
Are there any side effects to any type of treatments regarding colon cancer treatment?
I'm not really sure.
Like side effects, we know about maybe chemotherapy and everything else. God forbid someone comes down with it. But I mean, are there any side effects at all from just going in and getting the colonoscopies and everything else?
I think you're asking me about, are there any side effects from a colonoscopy
Correct.
versus a major operation for colon cancer?
Correct.
Those are completely two different things. But sure, from a major colon operation or chemotherapy or radiation, those are very different discussions. But from a colonoscopy, the average person, you have a little bit of gas afterwards, or you feel a little bloated, maybe a little touch of abdominal pain. But most people, when they're finished with the colonoscopy, feel just like they did when they walked in.
Are there different grades as far as colon cancer is concerned?
Yes.
As far as, you know what? You have a very light strain of it. Or, I mean, listen, colon cancer is colon cancer. But I would think. But give us an idea as far as the levels.
Sure.
If one contracts.
There's a variety. I mean, there's, like in most cancers that are staged in this country, they're mostly based on stages, stage 1, 2, 3, and 4. Within each one of these stages, there's a significant amount of information that's within each one of those. And this discussion becomes very complicated as we go along. But obviously, from stage 1 to 4, the earlier the cancer, the better the prognosis, the longer the survival. And as the stages go up, it really depends if the tumor's in other places, or do we see it in lymph nodes during surgery, or do we happen to see it in other places such as the liver, which is the most common. But, I think simply put, from stage 1 to 4, stage 1 is the earliest type cancer, normally with the best prognosis.
Interesting. As we get closer to this month of Colorectal Awareness Month, turning blue, Riverhead is, do you find that more people now are kind of calling up, making that appointment to get checked? Is it a coincidence? Are people kind of shunning it? I mean, where do you see this as you get into the month of March here?
I think the amount of what the hospital, I got to be honest, it's really exciting, this Go Blue, because the hospital really got involved. And that's important for us as well, as physicians who take care of these problems. When the hospital supports it, then the businesses got involved, and the American Cancer Society is involved. So we have a lot of momentum. And no, I don't think people are shunning. I think just the opposite. More people are coming. We also participate with the Cancer Services Program, where we help people who don't have insurance have colonoscopies and some form of screening. So no, I think the more people get excited about it, they start to read about it, they get more educated, and that's good. That's going to be the biggest impact in the screening.
That was my next question to you regarding insurance. I mean, give us an idea. What about people who are not as fortunate to have that high caliber type, whatever insurance they have?
Sure.
Does the Peconic Bay Medical Center, do they work with folks?
They do.
As far as that's concerned?
One of the great programs that I've been part of is something called the Cancer Services Program, and this team at Peconic is phenomenal. And we really help a subset of patients who can't afford insurance, who have their specific screening tools and parameters. But I think most patients don't even understand that that's available. There are some that do, but people they should look into the resources, call their local hospital, call their local facilities, call Peconic Bay Medical Center, and we could start help to try to figure out, can we get you screened or we can't. But most insurances, to be honest with you, are usually very gung-ho about screening, because if I prevent you from getting a colon cancer, I save them a lot of money. So for whatever the reason is, it's a good, screening is usually very well supported.
I can't thank you enough. Dr. Brett Ruffo, of course, the board-certified colorectal surgeon of the Peconic Bay Medical Center. And, of course, March. The month of March is Colorectal Awareness Month. We're Riverhead turning blue, folks. And that should be an incredible situation. Can't thank you enough for coming in, Doc.
Thank you so much. Appreciate your time.
Absolutely. Great stuff. Get checked. That's the bottom line. I mean, that's the one message you would want to get out to the folks. Get yourself checked.
100%.
Thanks for coming in.
Thank you very much.
Jay Oliver back with you. Dr. Brett Ruffo, board-certified colorectal surgeon of the Peconic Bay Medical Center. It's a big month coming up, Doc, because it is Colorectal Awareness Month, in which the town that you reside in, that you work in, is going blue, which is the only situation, I believe, on Long Island. What a great thing when you think about it. Breast Cancer Awareness Month, pink. Colorectal Awareness Month, blue.
By all means, blue's a good color for me, because it also represents my favorite football team, but also that the hospital and the businesses of Riverhead really spent a lot of time and effort, and they're making this something special, and they really show great interest in protecting the population that's out there from this disease that's essentially curable.
Did the color blue for March, representing this grave disease, have anything to do with the grave season that our New York Giants had?
No, but I think they should be the first volunteers for a screening colonoscopy, at least through our hospital.
Oh, my goodness, I'm telling you. You and I definitely have something in common. Boy, did we suffer for 16 weeks or
I think so.
You know, obviously, it's nothing to joke about.
Nope.
I went through it as far as the screening. I was very apprehensive. I got to tell you, very apprehensive. I was a little nervous regarding the anesthesia. When it was all said and done, maybe the best 15 minutes of sleep I ever had. I remember, I went in at 1:30. I'm out at 1:45. The doc comes in, shakes my hand. I have a little gas, and I'm ready to have a plate of ribs.
That's right.
I mean, you know, basically, I lost. Now, for me, my metabolism is I probably dropped 6 to 7 pounds in that stretch when I first started the bowel prep. But the fact of the matter is, you know, I was prescribed a certain type of liquid, and I drank it. But there are other types of situations as far as bowel prep is concerned. And basically, if one is not comfortable with one,
Right.
you have kind of an array of different types of things you can get, right?
You know, that's why I think education, again, we keep talking about this Go Blue campaign and the excitement in the town, which is great. The more important thing it's doing is allowing people to ask questions that they wouldn't normally ask. Well, what do I do with this bowel prep? And everybody's so afraid, well, I'm going to throw up, I'm going to do this. Well, that's possible, sure. But we do have a variety of different bowel preparations, regardless of who the physician that's doing the colonoscopy. And if one is not tolerated well, I just tell them, look, we'll reschedule, we'll give you another prep, try again. Because that's what's important. But I would like to say, though, I don't recommend it as a weight loss program. That's that's for sure. But certainly we have a lot of options.
But I remember, you know, it's not all about starving yourself and just drinking water. I mean, listen, I had ices, Italian ices, and everything else. I mean, obviously, there are certain things you can intake.
Sure.
You don't have to completely destroy your system here. It's not as bad, folks, as you would think.
I think no matter, even if you weren't allowed to eat for a day, it wouldn't be the worst thing in the world. But the other thing is, sure, you're eating. It's what we call a clear liquid diet. No, it's not a fun diet. It's not the ribs as you were talking about. But certainly, it's Italian ices. It's some type of light soups and things that keep you well hydrated throughout your bowel prep. And at least gives you something to put in your mouth as you're going through the day. And yeah, it's a little frustrating. And so the bowel movement's a little bit frustrating. But in essence, really, it goes by pretty quickly. And next thing you know, you're like you said, you finish with your procedure 15 to 20 minutes later. And you just had a really good test done for yourself.
No question about it. And you feel good. And you know something? It's a cleansing. I looked at it like, you know what? It's a cleansing. It's a great way to kind of evacuate, if you want to use that terminology.
Sure.
but it's a very good way, and you feel great about it when you're done because you know you have a clean bill of health, thank goodness, if you're lucky, fortunate enough, to get everything done and hopefully get that procedure where the doc comes in and says, you know what, you're fine. But it's interesting, I look back and we mentioned about genetics and family history. I have a grandmother who had colitis, very bad colitis, which could have been is that kind of a prelude to colon cancer if one has that many problems with the colon, or is that a completely separate situation?
Of course, it always depends on what the colitis is. I mean, we hear this a lot. It could just simply be a virus. It could be irritable bowel. So we never really know. I think anybody who's having trouble with their colon, regardless whether it's colitis or it's just upset stomach or it's change in bowel movements, that's the reason why we do the colonoscopy, so we can get biopsies. Because again, even though colon cancer, and this is Colon Cancer Awareness Month coming up, sometimes we help figure out other problems that patients are having. Sometimes they're having issues with their bowels that are unrelated to colon cancer. But just by doing the colonoscopy and getting a biopsy, we're able to help other problems and help diagnose other problems and make them more comfortable away from colon cancer.
Now, you and I had talked during the break. Now, you actually have a family member. Had a family member. Is your dad still around?
No,
he's not around. So obviously, this terrible disease, did it take him?
Miserably.
Miserably.
My father died when I was an intern, on call. Very, very widely spread metastatic rectal cancer.
Now, was this something when you decided to get into medicine? Obviously, you have become an intern, and then your father got ill, correct?
When I first went to medicine, no, it wasn't to be a colorectal surgeon, but there's no question that helped lead the way.
It kind of paved the way.
That's for sure.
Yeah.
But again, he's a classic example of what we got and why this Go Blue campaign is important, why the CSP is important. He didn't have insurance, and he was bleeding for a long time. He didn't tell us. Why would he?
How old of an individual?
He was 54 when he was diagnosed. He
young.
died at 56.
That's young.
And he was an old Italian, and he had his own ways, and that's fine. But it didn't work out for him in the end. And by the time he had his insurance and he got screened, he had a bad rectal cancer. So you can see the important. That's why I participate in these screening programs, and I'm really a big advocate of this Go Blue campaign.
Is that something you think still exists today? We hear blood from the stool, blood from the rectum. Maybe some might feel embarrassed by it. Maybe I don't want to get that checked. You know what? Very personal. Is that something that people still hold inside and could be a problem down the road?
I think every patient that I see, because sometimes we have to put patients in some situations or positions that they feel uncomfortable in. But when you take it back from the doctors taking care of you, if my father wasn't fearful, he may probably still be alive, regardless of insurance. So I can never take all the anxiety away from patients. I can't do that. But what I can do is try to reinforce the importance of it, and we'll try to make it as comfortable as possible. And at the end of the day, it's really not as bad as people think. It's just getting through that mental barrier that everybody seems to have when it comes to having their backside evaluated.
No question about it. We're talking with Dr. Brent Ruffo, a colorectal surgeon in the best sense, folks, over at the Peconic Bay Medical Center. The month of March is Colorectal Awareness Month, the month that will turn blue in the town of Riverhead. And maybe this could be, you think something like this could be contagious other towns in years to come? You could see maybe Babylon, and you could see the Brookhaven kind of getting into this whole situation?
I think that, I'm hopeful that it's more of a global issue, because I mean we're losing colon cancer. Colon cancer is going up the ranks; it's not dropping. Anything that will bring awareness, I think it's going to be almost viral. And it's kind of fun. I mean, you already see the excitement. I mean, businesses are creating drinks after these names, bottoms up. I mean, it's kind of it's not perfect, but it's fun, and it's helped contributing to this cause. And I think then you know what, some town will come up with another drink or issue that's going to make them stand out in a crowd. And next thing you know, you may have all of Long Island participating, and who knows where that will go from there.
It almost seems that's what it's coming down to. You look at Major League Baseball players wearing or holding pink bats, and football players when they're on the field with the pink shoelaces and pink gloves and pink headbands and wristbands. Who knows? I mean, this could probably be a new trend. I mean, is that what it comes down to these days, you think? The awareness of programs like this, affiliating it with colors. You know what? If it works, why not?
That's right. It's hard. I don't want to say, we can't sit here and judge why people do certain things. But the pink campaign has been viral. I mean, it's everywhere.
Right.
And it's interesting because if you ask the average sports person who's wearing that band or anybody, do they realize that colon cancer is above and beyond and it's killing more patients, more people than that? So I don't know how to get it viral, but I'm certainly willing to participate.
Is it painful? Not that any cancer is not painful, but is colon cancer a painful type of situation to try and correct, to try and be comfortable? Is it more painful than whatever type of cancer? I mean, how would you classify colon cancer in the sense? Not that anything is any good with any type of cancer.
I mean, honestly, like, we said before, it all depends on the location and whether it's in the rectum or the colon. But sure, I mean, yeah, once these diseases progress and they become symptomatic to the person as the patient, I mean, yeah, they're very painful and they can really change your quality of life. You can end up with a colostomy. You can end up with one anyway. So that's why I don't want to give any specific treatment options. But at the end of the day, if you can prevent having to see me for colon cancer, it's going to certainly improve your overall quality of life. You can assure yourself on that.
And the bottom line, folks, is get checked. I mean, let's face it.
Go blue.
Insurance, no insurance, get it done. Somehow you have to get it done. You have to be able to get it checked out. Because, listen, that's the only way to live a normal quality life. I mean, let's face it.
But the last thing, make sure people need to understand, though, there are resources that they may not be aware of. So I don't know, if they contact their local facilities or even call our institution, I mean, it's not, we may be able to at least help guide people in the right direction.
I can't thank you enough for coming in here. Dr. Brett Ruffo, he is a board-certified colorectal surgeon over at the Peconic Bay Medical Center. Next month, folks, in the month of March, Riverhead goes blue. Why? Because that is all about the awareness and that affiliation with the color blue. Hopefully, we'll do what pink has done for breast cancer awareness.
I hope so.
That should be an incredible thing. Pleasure to have you here.
Thank you so
and
much.
Come back anytime. Great stuff. Dr. Brett Ruffo, board-certified colorectal surgeon. I'm Jay Oliver for 1039 LI News Radio.